All right, I think we're ready to begin. Welcome to the March 7th Utility and Security Concepts Gravity Terminology Call. Next slide. For those of you who don't know me, even though most of you do, I'm Sarah DeSilva. I'm the Director of Terminology for the Gravity Project, and really honored, as always, to be here with all of you on our Thursday afternoon gatherings. Thanks for joining. We do ask that everyone starts muted, but we quickly unmute to have conversations, as you all are aware. The call is always recorded and always available on the Confluence afterwards. And as you know, if you're a longtime member or if you're new, just know the chat is an active participant in the conversation. So please put anything you want to say or comments in the chat to everyone, and we'll make sure that we highlight them as we go along. Next slide. This is our common antitrust practices slide. So Gravity Project participants have the responsibility to comply fully with federal and state antitrust laws. Once we're this far along in a build, in a public identification process, I stop reading all the details. I hope my friends are okay with that. The elements of this are commonly known to everybody who's been on prior meetings. And so just please make sure that we comply with antitrust practices according to HL 7 requirements. Next slide. All right, it's a tiny little agenda, but let the agenda not belie the amount of content that we have to address. So that is the first part of the welcome. We have a lot of new instruments to go through over the course of our time today. And again, those instruments being really critical for highlighting the measurable dimensions of a domain. So we're looking forward to reviewing those with you. And then we'll close with community homework and next steps. Next slide. Next slide. We have a few announcements. So number one, if you missed it, so Gravity had an all project annual update on the 28th of last month. Vanessa Candelora, the program manager, Corey Smith, my colleague and technical director, and I presented on 2023 lookbacks and 2024 vision. The recording's available on the Confluence. It's a nice get to know you webinar. So if you want to see if you're a terminology person who wants to understand what's happening in tech or implementation, or if you want to share a webinar to the community, as to friends to try to figure out what you do over here on Thursday afternoons, it's a nice overview. And it can be accessed and shared via the Confluence. Terminology updates. So for those of us who were here in the fall, we are presenting our digital literacy ICD-10-CM term at the ICD-10-CM Coordination Maintenance Committee meeting on March 20th at 9:25 Eastern Standard Time. I'll be doing a very, very brief presentation, and you can learn more about the process and how to register at the hyperlinks in the chat. Again, thanks to Sarah Bahal for dropping those in. We always want to welcome everybody to the technical workstream meetings and our other meetings, the Pilot Affinity Workgroup meetings, to participate in all of the exciting activities that are happening in those space. I happen to know the agenda topics of the next pilot and implementation workstream meeting, and it's terminology focused. I'm going to be working with our friends at the Partnership to Align Social Care Building and Coding Workgroup on presenting on the new calendar year 24 social needs related HCPC codes for community health integration, principal illness navigation, and social risk assessment. And then I'll be doing a deep dive in how those terminologies and HCPCs relate to Gravity terminologies, so that you can have the broad reimbursement of the HCPC, but meet all the granularity in Gravity intervention terminology. So that's coming to you the last Thursday of the month in March, which will be the 28th. So a terminology focused webinar. And again, the pilot implementation workstream in general has a fairly new focus, which is, given the status of implementation, we want to create these repeatable educational sessions so that individuals can share and reference and come back and kind of help create a community of leading edge implementers to collectively learn from each other. So it's a pretty great group. We had a great presentation just recently from a technical standpoint, and that again can be found on the Confluence. Next slide. These are our use cases. They ground the things we do, documenting social care at patient and client encounters, tracking social care interventions to completion, and then gathering and aggregating social care data for uses beyond the point of care. I talked about the co-design report last time. And I also just want to mention that this is leaning into data aggregation and population level information. It's a pretty important focus of our work in 2024, trying to figure out how to create enough information population at a population level in order to understand outcomes at community levels and drive structural changes. So that was, again, an outgrowth of the co-design we led with the social care partners. Again, that is available on the Confluence as well. We talked about that in the last meeting, and we look forward to leaning into this use case in 2024. Next slide. These are our sponsors and members. We have a really wonderful and robust member group right now, and these include both paid financial sponsors and members, but also designated members that are really helping us make sure that we round out our social care, community-based organization, and patient voices. We couldn't do any of this work without them, so thank you so much to all of our members, and if anybody wants to become a member, let us know. Just a plug to all of you. We really want to improve representation among our provider work groups. So anyone who's actually doing clinical practice and clinical care. We have, again, a pretty great burgeoning representation from our community-based organizations in those designated roles. But health systems, people who are actually trying to integrate these terminologies and technical standards within patient and client encounters, we would love to have more membership there. So if you have ideas about a health system or a clinical entity that that can become a member, please let us know. We would love to include them. Next slide. Next slide. So this is our longitudinal roadmap across the many years now of our inception, and we're working on utility and security right now. And then very shortly, you'll start to see, once our operating committee identifies the next domains of reference, you'll see our fall domains come onto the 2024 list as well. Working through, it's our pace is simmered because there's so many other layers of information and things going on in the project right now, but I'm really grateful to focus on utility and security with our brilliant SMEs right now. Next slide. This is an updated roadmap, and this is because, as you are aware, we are working only on utility and security right now, and this is, largely because our imminent blending and braiding of funding from, Reg and Streef and from our members and sponsors really had us leaning into just this one domain for now, but you can see things pick up in the fall. We do anticipate starting that coding for food work that we talked about in the fall of 2023 and fall of 2024. So you'll see those critical HCPCS codes for food interventions that work to kick off in August when we restart after the summer break. And again, our members are leading this new use case discovery in social care payment and reporting and outcomes and tracking and measurement. Again, that outcomes use case and discovery is related to the data, the third use case, that data aggregation and outcomes use case. So, and again, both of these were raised up by the social care voice co-design work. So a lot of synergies across all of our stakeholders. And then one of those use cases will make it onto our roadmap as a formal use case in 2024. There is a lot going on in our technical world as well, working on updates for aiming toward a update possibly later on this spring. And then the implementation work group, we talked about that as well. A lot happening there. Again, really creating an implementation collective to share resources and perspectives on advancing widespread dissemination use of Gravity deliverables, both terminology and tech. That's our lane. Next slide. Sarah does like to attend meetings. Sarah packs patient care into 2 very long days. Any questions on the roadmap as edited? Again, moving, mostly what you saw happen is the coding for food got moved to the fall because that's where we're going to begin as we get all the different partners and organizations and funding together. Thank you, Sarah. Thank you, Sarah, Team Sarah. All right, next slide. And now we go into the work that we have ahead of us today. Next slide. I do see some possibly new members on the meeting. Welcome. Again, oh, I forgot to do the put who you are and where you're from in the chat. My apologies. Today's a high-tech day, so I'm like, I've been sitting in this chair talking all day. But so if you want to put who you are and where you hail from, that would be helpful in the chat, so everybody can know who you are and where and what our perspective is. This is an example of how our terminologies that we build in this meeting are applied to practice, right? So in the food insecurity example, you can see the terminologies of screening instruments, the terminologies of diagnoses in both ICD-10-CM and SNOMED-CT. Again, we have that digital literacy ICD-10-CM coordination and maintenance committee meeting very shortly. And then we have patient-centered goal statements, and we have intervention terms across our intervention categories and our criteria, which is like education, assistance, like adjustment, etc. Next slide. This is a slide we just made, and I presented it last time. I think I'm going to present it one more time, and then we'll let it sunset into the reference overview deck. The reason why I want to bring it forward one more time is because this is all of you. This is what we do, right? Gravity, terminology, and value sets have the honor of being referenced by many, many policies that are in the ecosystem, quality measure policies, regulatory guidance. And it's because of the rigor and the carefulness of what we do here together in these meetings. So it's grounded in evidence, it's consensus driven because of all of you, public and available and ready for comment in HL7 processes. We do ensure semantic consistency across social care taxonomies and wording and programs and expertise, so that as we build terms in HIT, we center the wisdom of those who have been doing the work for the longest amount of time. And we have our principles that ground us, the ethics of data justice and social justice weave through everything that we do. And then we have our formal process, right? So in the pre-work, the team and I, mostly the team, but there's a really extensive literature review. And then we do our identification process that we're in now, then our formal consensus end-to-end review, and then our vote. And the terminology team sets into building all of the terminology requirements with our friends in the terminology ecosystem, including some of who are on the call. So thank you, friends in the terminology ecosystem, for supporting this work. Next
Sarah?
slide. Yes?
I don't see where to raise my hand here, but can I just ask you a question about this slide?
Always, yes.
Thank you. Submissions to standard code systems.
Mm-hmm.
Where is SVAP in here?
Oh, yeah, so we submit to SVAP's not here. We could add it. That's part of the USCDI process too. So we submit to the terminology standard, to the terminologies themselves. They then get wrapped up into our value sets that are within that are referenced within the USCDI V2 activities, right? And then that would be aligned with the development of systems within SVAP. Does that make sense? So it's not, we could put it here, but it's not part of the same 6-month terminology process. It's more about dissemination.
Okay, I'm not really familiar with these systems, and I'm trying to learn how we fit into them. That's why I asked that.
That's a really good question. So this, as represented on this slide, we're trying to represent the terminologies themselves.
Okay, gotcha.
Right.
Thank you.
So you can see there's HCPCS, LOINC, ICD. The National Librarians of Medicine is there because they are who we work from, depending on the nice little going back to the wheel, depending on the terminology itself. But that's that slide. If we go back to the process slide, is really about the codes themselves and how we build them. Is that helpful? I hope it is.
Yes, thanks.
That's how the ideas that we form together get into the value sets we make, is because we have to do a lot of building. And then once the codes are there, they're available in VSAC, and we're able to put them into our value sets. And that kind of is, that's what this process is talking about. All right, next slide. And next slide. All right, so we're in the identify phase where we identify gaps and needs within terminology to support different domains. Next slide. We are pretty close to our, we're kind of like, midway through our process. So we did want to, our very thoughtful team wanted to make sure that we had a kind of a rough deadline for submitting new concepts. So if by April 11th, we're hoping that April 11th to be the time when people would submit concepts for review, like instruments were missing, roles were missing. And this is in order to enable integration into that final end-to-end review that we do collectively. Oh, hello, Rob. You probably could have given a better answer to the SBAC question than I did.
You're in charge now.
Oh, well, I know. Depends on which hat I'm wearing, I suppose. Next slide. Any questions on this? Again, submit your concepts to April by April 11th. And then this is the where the kind of the organization of the confluence. Again, everything that we do is public. This is part of our process. Everything we do is very formulaic. We're nerds about all of this, right? So you can always find the master list on the Confluence after the call. It's posted on the Friday at 5 p.m. EST after the public call. Any of our working ideas in progress are there. Our instruments are there as well. If you ever need a orientation, just let us know. But all of this is found via going through the terminology workstream tree on the Confluence. And again, reviewing those master lists, especially during end-to-end review, is really, really important. So if anybody has any questions about how to do that, please let us know. We really want to make sure that this is a robust and carefully reviewed set of information, given how important it is. All right, next slide. And now we're going to go into concepts. Two of our subject matter experts are here. I believe we have Dr. Hernandez, and who is, I think, possibly in transit, and then Stephanie, Dr. Stephanie Editor de Cuba, who is here with us as well. One of our subject matter experts couldn't be here today, Dr. Frank. Next slide. Oh, here they are. Our wonderful subject matter experts, our Friday afternoon WISE gathering that we have every week. Next slide. There's not a huge amount of change here. Again, I just want to highlight one change. So we are the working realm is utility insecurity. We've been focusing a fair bit on energy insecurity and its subtypes. I do want to state where we've landed is that water access as a utility is clearly within scope. The instruments, whether they be HUD instruments or whether they be Children's Health Watch, there's reference to water as being intertwined because it's as a paid utility. We have kind of agreed that, as we always do in gravity domains, when we identify things that are important but not necessarily within the scope, we always put it as a future work, and that's how our terminology domain roadmap flushes out, right? So now we are responsible as a team for putting water security in general, especially related to environmental considerations and contaminants, onto the roadmap for consideration for future work. And we're really grateful that, again, with our partnership with Registries, we'll be able to consider prioritizing that domain likely for future work within the next few years. Next slide. And now we're going to get into some changes. So this is, again, the grounding. So everything that happens from here, that was a lot of information. We're going to revisit this slide in a second with a little twist. So just again, a grounding of the financially driven social insecurities. They have these common themes of worry about losing it, the stability of the resource, the quantity or presence of the resource, whether it be housing or food or energy, the quality and safety of that resource, and then that final element of cultural acceptability. It applies to generally across almost all the domains, but there's limited measurement for it at this time. And we think about dimensions both because they're what's measured in our instruments, and we'll see that as we go forward. And we also think about domains because they often drive what we can do, right? If we think about housing, our interventions for housing quality are different than our interventions for housing stability, right? And so we always try to think about these dimensions both from a measurement perspective, but also from an intervention perspective, because we want to create actionable concerns and conditions that can be tracked and linked to interventions. So, and we'll talk more about this and we'll bloom over the course of, oh, so Rob is wondering whether we can get access to the slide deck for the meeting now. We might be able to do that. It's hard because the team is tiny and the team is here, and so we'll see if we can do that for you. But might have to happen after the meeting because we don't want to. Is that okay, Rob? I hope it's okay.
Yeah, oh, whatever possible. Just
Okay.
wondered.
Yeah, we're a tiny team and we each have a role in the meeting. Next slide. All right, next slide. We're going to go through a lot of updates on screening assessments, and what I want to highlight with all of you and our subject matter experts, Stephanie, Diana, pop in here, is the expanding list of dimensions of the domain as we think about utility and energy insecurity. So there are a host of new instruments and additions to instruments. The instruments that are included or aligned with the Accountable Health Community's health-related social needs screening tool. And you can see it has, that question as adapted, which we'll talk about shortly, is referenced by many other instruments. There's the VA Assessing Circumstances and Offering Resources for Needs screening tool, the ACORN tool. We have some additions to the New York City Household Energy and Health Survey that was referenced in the work of Dr. Hernandez that we've talked about. Again, the papers, some seminal papers that Dr. Hernandez has published and Children's Health Watch has published are all available on the Confluence in our references section. We have the Administration of Children and Families Office of Community Surveys Home Energy and Security Scale. We have the American Housing Survey, which is a HUD instrument. We have Prepare from the National Association of Community Health Centers, and we have We Care. There's a lot. And what I want everybody to note is not just the questions, but the dimensions as we go forward, because again, those dimensions are things that we'll be talking about when we think about building problem statements and, and SNOMED CT terms as we go forward. Next slide. All right, so this is the base Children's Health Watch instrument that we presented last time. So you can see there are the questions of primary energy source and questions of primary cooling method and questions of does someone in your household pay for heat, electricity, and water? And Stephanie, feel free to chime in here since this is your instrument. That is always it's critical because you don't want to proceed in asking somebody if they are behind in utilities if they don't actually pay for them. This is common in lots of rental facilities as well. And then there's these themes, again, these dimensions are highlighted in bold. So threatened to not deliver the utility, refused to deliver. And then these experiential ones, not heated or cooled, using a cooking stove, or threatened to shut off or refuse delivery of water. What I want to note is, again, Stephanie, you can pipe in here, is that Children's Health Watch includes water as a utility, and within that scope that we have agreed on, which is what is paid for as a utility and not elements of quality, again, that we'll talk about later. All of these are previously presented. I wanted to start with them because you can see the next slide, how they, the Administration of Children, I'm sorry, I'm getting an Amber Alert on my phone that's stopping us. My apologies if you can hear that. Okay, next slide. All right, so when it comes to the reason why I presented the Children's Health Watch instrument first is in the work of the Accountable Health Community's health-related social needs health screening tool, they adapted one of the questions from Children's Health Watch and added water as an additional concept. So you can see on the previous slide, Children's Health Watch had the utility, the gas and electricity as separate concepts, and then water as a separate concept. And the AHC instrument combines them all into one. Stephanie, are there any thoughts on this? Do you want to pipe in here? Am I doing an okay job?
No, it's awesome. I don't have anything. The only thing is, yeah, they took the threatened and the actual shut off, and I think this is the one where they put the shut off into the answer options instead of,
Correct.
yeah.
Yeah. Yes. Lucy?
On the previous slide, I think someone mentioned at the last meeting, what about wood for
Oh, yeah.
heating?
That's coming.
Okay, great.
Yes. Yeah. So we have some pretty great updates on that one, and I want to thank my team for reminding me of things that I had researched before. But we do. There's been lots of really wonderful conversation in our SME huddles on approaches to rural populations, and one of the instruments that we offer right now that we're including has very broad definitions of heating that do, and it's because of the author. We'll get there shortly. Coming soon to a terminology meeting near you. So the AHC HRSN screening tool is the base. Again, that exact question is referenced across both of the AAFP instruments and health leads. And so we just presented it this way here. And again, all of them combine water and then have already shut off as an answer. So they combine threatened and shut off into one question. We do agree that this is a fairly, a good, a possibly good entry-level question. However, when you start to look at some of the additional questions, it might not be as sensitive as an initial question might want to be. Again, that's very vague, but we'll get there. Next slide. Oh, and that's so Stephanie, do you want to come off? So when you talk about heating sources and the initial question of the Children's Health Watch instrument, you ask about wood, correct? Is what you're saying?
Yeah, some of the answer options include propane and wood in addition to gas and oil and all the other things for that very reason, because that was a common answer among our more rural participants.
Thank you. One of the amazing things about this subject matter expert grouping is we have tool authors and psychometric researchers in the meeting, and so these kinds of questions are easily answered. So we're very, very lucky with Diana and the Children's Health Watch team. So these are some additional instruments as well. We have the VA ACORN instrument and the American Housing Survey. We do want to note that the VA instrument does include phone. This is not typical in utility insecurity questions, and we're just calling it out here. So it's trouble paying for, this is a leading question. How often do you have trouble paying for utilities, i.e. electric, gas, oil, water, or phone? And then it does have the secondary question that relates again to these dimensions of utility and energy insecurity, which is the threatened to actually utility insecurity, sorry, because it's gas, oil, or water, and it's that threatened to shut off services. So we have this, even though the first question includes phone, the second question really drills down into the utility-driven elements. On the right, we have questions from HUD, the American Housing Survey, and we have behind on electricity bill, notice your electricity would be shut off, and then has your electricity actually been shut off, right? You can see these are electricity specific questions, but again, they follow that federal template of questions that we know very well from USDA and the food security modules, and you'll see them again as we come back around to other instruments from the feds. Next slide. We have two last ones. So one is from We Care. Do you have trouble paying your heating bill for the winter? And then we do include the secondary question, if yes, would you like help with this? Although that's not usually included as like a face valid question for the domain. It's like a explainer or additional information. And then if yes, are you at risk of having your utility shut off? Again, the highlighted themes, right? Trouble paying and shut off. And then we also have the prepare question. In the past year, have you or any of your family members been unable to get? And then we highlighted here utilities, because if anyone's aware of question 14 in prepare, there's this pick list of all the things you might be having a hard time getting or unable to get, and utilities is one of them. And it also includes food and clothing and phone, and it's a very high power question. Again, noting though that unable to get is a kind of down the scale experience, right? So it happens after worry, it happens after, coping, and it's like not having it all. So just as we think about screening questions and sensitivity and specificity, it's important to note those questions that are good questions but might miss populations based on the fact that they are farther down the scale. Elena's asking, so sorry if I missed this, but do we have a question to capture if they are currently in the dark or having something shut off, not just in the last 12 months? And so Stephanie, you're probably the best person the Children's Health Watch instrument does do this, and most USDA instruments, most federal instruments allow you to change the look back to now. But Stephanie, do you see Elena's question and do you want to comment on it?
Yeah, I mean, so I think that's where so ours is a research-based survey. It's not like a services survey, although obviously when people raise stuff, we have like the end of our survey is, and what can we help you with? And then there's a whole list of resources that we can help connect people to with. So that's one thing to say, but that's why we don't have a is immediate question. But I think that's one thing I like about the We Care setup is that they like the follow-up question of, do you need help with this? Because I think that's where some stuff like that comes out.
And then you have the acuity in the third question too, like, are you at risk of having your utility shut off in the next week?
The reason that because that's like an eligibility for an accelerated
Yes.
success. So without that specific question of not just like, how can we help you, but like, this is the truth of my situation. Like, I want to be able to map the data element I have in my system to that value. And that like present situation is part of access. So that's part of why I'm wondering about it.
Elena, I think again, I try to remember all my question children, but I think that one of the questions might get to that. But this is also where we often lean in with our dimension instruments, with our dimension statements. It's like you can remember this from like housing instability, right? Like where we were like, or maybe I'm sorry, I'm not going to assume anyone remembers anything, but this like imminent risk of homelessness, right? So some of our statements of need or statements of social risk are designed to align with things like, McKinney-Vento, homelessness qualifications, right? So if there's a specific status that is a universal standard for qualification for expedition, like expediting entry, that's where also, even if there's not a question for it, we usually try to lean into a statement that we can name it so that patient can be identified, followed, and tracked. Does that make sense? Am I making sense? Elena, what I just say make sense to you?
Can I just add, Sarah? I believe one of the questions. Hi, sorry. So I believe one of the modifications to the Children's Health Watch question, when it was kind of combined, not only including water, but then including the already shut off option. I think that question of like whether or not there's an active shut off.
This is the next slide.
As opposed to just a 12-month look back. Oh, sorry.
Yeah, no, you're right. You're right. So both there's the already shut off, but if we go to the next slide. Oh, sorry, the AHC health related social needs instrument. You're doing a really good job. One more. Back. Back to AHC. Here we go. Keep on going back. I'm so sorry. Anyway, the answer to this question include an already shut off statement, is what Diana was saying. So when the AHC health related,
one of the pick list values of the responses is I am currently in the dark, or it's
correct.
Off. Okay, perfect.
Correct. Yes. And my apologies that it took us a while to get there. We try to remember all these things, but yes. Thank you, Diana, for highlighting that. That was helpful. And Stephanie actually already said it, but I forgot. All right. Next slide. I think now we're going, I think we've moved, I think we're here in the next slide. And then next slide. All right. So this is where we're transitioning. So those are brand new instruments. Most of those are brand new instruments except for Children's Health Watch. This is a summary again. The AHC instrument combined things from Children's Health Watch, both in threatened and already shut off, and they also put water up with the other utilities. And then you have the additional instruments from the VA and National Association of Community Health Centers and We Care. I brought us back here because this is the instrument that Diana used in her research in New York. These are the dimensions that we'd already talked about. I do want to say appreciation for Diana's structure because she already puts the dimensions as highlighted, so it's easy to track. So these are the things that we presented when we last saw you. I ground us here because the full New York instrument is going to unfold over the next slides, and then we'll go into the Administration of Children and Families instrument, and you'll see this echoing. So we have a few very specific dimensions we've addressed so far, which is a disconnection notice, threat of shutoff, and then trouble paying, right? And so again, all those highlighted themes that we had on the slides, and we're going to see over the next slides some additional dimensions that are really important when we consider this domain. Again, these are the ones that were previously presented, and you'll see them echo, but slightly echo over the next slide. So next slide. I've taken, oh, hi, Lucy, yes?
Yeah, could you go back to the previous slide, please?
Yes.
Thank you. With respect to disconnection, one of the things that's happened in California in the last 2 or 3 years is disconnection without notice because of wildfires or other drastic situations. Do we need to take account of that in here, or we're really just dealing with people who actually make it to their appointments and then get a set of questions?
That's kind of a scope question. I do want to note that Dr. Hernandez's research is really broad. Diana, do you have anything to say on that? Even as we specifically focus on utilities, these kinds of like structural, and Stephanie, you talk about this with environment and climate as well. Anything our subject matter experts want to add regarding these structural or community level forces on supply?
Yeah, I mean, I think that the power outage question is really important because especially when we're thinking about, let's say, the use of electric medical devices, in some ways, we want to know whether or not there's an affordability pathway to not having services, but also if there are like kind of reliability factors that are impeding access to energy. I don't think that as a group we have really engaged the questions of outages, but I see that as a part of this work. So I would hope that we do eventually, kind of tackle that. I don't think that we have a good response right now, but in terms of scope, I do see it as connected.
I want to thank you, Diana, because the fact that this has happened has resulted in new regulation with respect to our public utilities and what they're supposed to do exactly for the use case that you just brought up, which is people whose lives depend on it.
Yeah, and you'll see we have a very important question regarding electric powered medical device and adaptive devices that we have at the end for that in mind. We do have a brief from we did from the rurality standpoint, we did pull in, I think, a white paper on rurality that talked about outages in our references section. We really are trying to lean into these things, and but also just limited by the questions we have. work to happen. Yes, Stephanie is correct. Hurricanes, not just correct. And again, in rural ice-driven climates like I live in, outages are very, very common. Just because of tree lines and electric wires above ground services to rural populations. So thank you for highlighting that, Lucy. We appreciate you. Okay, so again, these were the concepts that we presented last time, and you're going to see them. Again, these are all from Dr. Hernandez and her team in their work. And again, the paper this comes from is all available on the Confluence, as with papers from Children's Health Watch. Next slide. So what, again, I don't know. So Dr. Hernandez is in transit, as usual. So what I did in order to present these is I literally pulled it directly from the paper. So if you look at the paper on the Confluence, the larger title of how Dr. Hernandez and her team grouped it is there, this economic dynamics. And then the questions are there with their concepts as how they're, how they're defined. And then, this cascades over a few different slides. So, Diana, can you see, or do you want me to lead this? I think she's probably, I'm gonna lead it until she pipes in, because I know.
Yeah, I think you can, yeah, if you could lead it, then I can just chime in.
Great. Okay, as long as you just know it's literally verbatim from your paper.
Yeah, no, that's fine. Yeah.
Okay, so this is the economic dynamics section. There's a couple new ones that again are really important. This difficulty paying concept, right? Which happens, which might in a scale happen prior to getting the threat of shut off or having actually shut off. And Dr. Hernandez also raises a concept, and her team raised a concept of utility debt. And an amount that of concern. Again, this paper is regarding concepts of energy insecurity and their associated health conditions. And we talked about some of these elements in the kickoff. Oh, thank you, Sarah. Again, I grayed out the ones we've already talked about again. So these are adding questions from the instrument that, that Dr. Hernandez used in her research. Next slide. And again, we're working on, I want to note that right now this is presented as published in the paper. Dr. Hernandez is very kindly working with us to adapt some of the timeframes to be more generally applicable. For now, I just kept it exactly as was in the paper because I wanted to give her the courtesy to refine it, just to give it a little bit of a breadth, but know that the time frame specific to the time of research, but the time frames will be revised. I just didn't want to deviate from the paper for this meeting because we just did this like last week. So then there's these coping responses elements, and you can start thinking about, again, those dimensions of insecurities. So reduced energy use over the past 12 months. Did you use less energy because you were worried about not being able to afford it? No heat run due to cost, and no air conditioning due to cost. And again, grayed out is this coping response we addressed prior, which is stove or oven for heat. Next slide. And then we have these physical condition indicators, home too cold or home too hot. So in the past 12 months, has your home ever been extremely cold? Or in the past 12 months, has your home ever been uncomfortably hot? We had Diana and Stephanie can pipe in here, but we had a large conversation regarding how even when you're not responsible for utilities, and they're dictated by your landlord or your houser or the person who's responsible for housing, sometimes these things are happening outside of your control. And so that's part of what Diana focuses on in her research. Diana, is that fair to say?
Yeah, that and also I think this came up last week is, we distilled what would otherwise be like, drafty home or a home that's in need of physical repair, energy efficiency upgrades, to this like thermal extreme around being too hot or too cold. A lot of the previous work was very focused on the heating component, but obviously with rising temperatures, the cooling issues are important. So like the extreme heat at home, we know presents with health risks. And then, yeah, so I just wanted to mention that we kind of think about this as like the way to understand the experience of the physical dimension of energy insecurity. It is, it's not perfect, and I think it doesn't kind of get at some of the like housing needs, but it helps to at least approximate like some of those issues.
Diana, your comments make me think, Lucy, of another application. It makes me think of the Texas energy supply and how we lose so many people with disruptions of energy supply in air conditioning dependent environments. And that is unfortunately a common theme across the South at this time, especially within climate change. And even in urban populations, right? This happens in New York City, it happens in different cities. So the coupling of this physical experience and Lucy's outage, even in the presence of being able to afford the bill, sometimes the system just fails.
Can I ask a question
Yeah.
that was just, I think, addressed, but I'm not sure what the result was. So the home structural issues with regards to, you said you distilled down the drafty house, and I'm not sure if you meant to this. And then in that context, the presumption is this is even if you have a, you know, I guess, I'm trying to think about how this applies in a hot environment, but a drafty house that you can't properly manage the temperature in, it's still a utility question. Is that what you decided?
Yeah, so we decided that for this kind of particular exercise and trying to get at some of the core indicators, that the drafty house makes it both difficult to achieve thermal comfort, and then obviously drives up the cost of like operating utilities. So what we did was, kind of land on this thermal extreme as a proxy for some of the physical aspects.
So,
So
but was that an answer
it's
that
not,
it is or is not a utility question?
it is.
Okay.
So, yeah, I mean, I don't know what you mean by utility question.
Talking about utility and
But
security. That's why
well,
we're
yeah,
at
I
it.
mean, I think, yeah.
I mean, I'm trying,
Because
I'm
of
not saying
the,
that you can't ask this question, but I mean, going through this, and I admit I'm new to this, so and you guys have a system, but I'm trying to kind of say, okay, and trying to kind of get the kind of characteristics of these questions.
So
And they come into, they fall into two areas. You've already talked about that. One of them is we're asking questions that are valuable in research that may or may not kind of give you the details with regards to how do we fix the problem. And then you got these questions on that very much lead to how do we fix the problem? What do I need to give you? And this, that's what I'm trying to get a sense of. Did you kind of put this into what I need to get you is utility help, or are you saying I have to figure out if this is a utility or I have to fix your house question?
Dana, do you want me to try to pop in here? Oh, Monique, it looks like Monique has it. But I want to note that in all approaches to energy and security, weatherization is one of the focuses, right? And like improve, like if you look at the low income energy heating and assistance program, because of the intersection and the quality of the house and how and the utilities, the expense of the utilities that are required to keep it warm if the quality is low of housing, these things are kind of interconnected in both the questioning and in the interventions.
Okay.
And you can see that really we can see that really well in some of the ACF questions on LEAP, which were the ACF is the division of HHS that administers the low income energy heating and assistance program. Because what you can imagine is if you again, sorry for all the anecdotes, but I have many patients who live in in trailers in rural populations in a very cold environment, and they cannot afford to overcome the deficiencies in their housing, so
Right.
they are always cold, right?
Yeah, no, that kind of answers it. I mean, you're right that if in terms of how do I fix it, it needs to always be just don't pour more money into it and help you spend more money on gas or wood or whatever it is. That there's another thing too. Okay, so that helps me kind of understand.
especially from a sustainability standpoint, because our subject matter experts are also sustainability experts, right? And so it's both as we address climate, the crisis of climate change in this experience of this, we also want to be careful to not, to listen and learn from the energy sources that are driving the problem. So I hope that the answer is okay. Then Monique probably has something brilliant to say.
I was going to say, I mean, this is one of those questions that, it's a sensitive question, but it's not that specific, and yet it has value. So it might pick up somebody who's, turned the heat down and, trying to conserve their money costs. It may pick up somebody whose wife insists on keeping the house, colder than they like it. But it is it may warrant more questions as to the cause, but I do think it throws out a pretty big net, to sort of, it's sensitive to pick up people who are living in conditions that they may find too hot or too cold. And then if the reason for that is because they want to just, conserve energy for the population, that's a different reason. But I think it still has some merit to pick up,
I absolutely agree with that. I'm just, again, I'm trying to catch up in terms of, and I think you're right. So as we looked at these other questions, this one is a broader question, broader set of questions. And I don't know if part of this is like, okay, how do we figure out what are the broad questions that we would put into the really short initial set of questions that we want to encourage
that thought.
Sarah's going there.
I gotcha.
Okay.
I love
So you'd be marking this as this is a good starter question.
Maybe no, well, yes and no, and this is part
Go
of
on.
yeah.
Go on.
Well, no, I want to I'm going to have us carry through, right? Because Diana and Stephanie, I just want to note that in order to be a good starter question, you have to be fully sensitive, right? So home too cold and home too hot will miss patients who are in the worry stage, right? And then in some of the earlier stages of insecurity, possibly, right? So this is partly, Diana, what I believed you were raising in the subject matter expert meetings over the last few weeks. But I'm just going to have us hold again. It's because we're about to introduce another instrument that might help us find a way. Dan, any other thoughts to say before I move on?
I think one other, so in addition to the weatherization and like housing improvement, for renters in particular, this might also signal something around like housing code violations, and maybe the need to refer to inspectional services. So there may be kind of different use cases for this kind of question. But I agree I think the next set kind of get at some of those worry issues and things like that. So I want to keep the conversation going.
Thank you. The good thing is now we understand the intersection of housing in this domain, right? Because they are interconnected. The quality of the house is interconnected with the utilities required to heat it. I live in an old Victorian. I know this well. And we're gonna explore it. So what we had with the New York instrument is an expansion of some of the dimensions of the insecurity, right? Because we had the Children's Health Watch instrument to start, and we've expanded it into some further coping strategies, some even lighter economic drivers, which is just worrying about not paying, right, or having difficulty paying prior to getting a threat of shut off, right? And these experiential ones. And if we go to the next slide, we're going to look at a different approach of kind of echoing these dimensions in the ACF OSC scale, which may help us look at a path forward for like if we wanted to do for shortened instruments that could be used in clinical practice, along with the other one-item questions we already have. All right, so LEAP, the Low-Income Heating and Energy Assistance Program, is administered through the Administration of Children and Families, Office of Community Services, Division of Energy Assistance. This is their home energy and security scale that they have, and by a scale, it means that they've designed it. And again, I am not the psychometric person on the call. I mean, I'm a psychometric nerd, but we have our measure developers in the room with us, right? So it has this gradient that can be used for understanding the ascending severity of the condition. For people who are aware of other measurement instruments, this is aligned with how the USDA food security module is organized, or instruments that screen for depression, like the PHQ-9, right? The PHQ-9 can be shortened to the PHQ-2, and that's this highly sensitive brief initial questions. And if you're negative, you're negative. And if you're positive, you might be positive, right? So erring on the side of sensitivity. And Rob, you and I have had lots of nerdy phone call conversations about this concept over the last few months. So the agency that oversees the administration of LEAP has developed a scale to assess the energy security of U.S. households. You can see the dimensions very much align with some of the elements, with the elements Dr. Hernandez discussed. Stephanie and Diana, pipe in whenever you wish. Again, the structure of the questions and the answers is very, very much akin to the USDA food security modules. And so that's comforting for those of us who have to build questions and answers into LOINC. And we're going to go through those questions on the next slides. Next slide. Henceforth, I will be abbreviating it to the ACF OSC Home Energy Insecurity Scale, because saying that long name is exhausting. And again, the methods of administering the screen is very, very much like everything we see from USDA. So this should feel familiar. It also is akin to the incoming HUD, household, and the housing security scale in development, which is different than the American Housing Survey. So these are these themes again highlighted. That worry theme, worried whether our home energy bill would become overdue before we could get money to pay for it. I'm sure this feels familiar to the food insecurity folks, because there it is. We remember this question with food insecurity. Our home energy bill became due and we didn't have money to pay it without somebody's help is another dimension. We couldn't afford to heat or cool our home to the temperature we wanted it to be, or use our water appliances to the extent we wanted to use them. Right. So again, that's like that's kind of an early approach to the themes that if you have autonomy to control the thermostat, that that Diana had on her instrument as well. Any questions, Stephanie or Diana, before we keep going? Are we good? Doing okay? Next slide. All right. And so then this goes in, again, we're pulling themes from, we can see these themes in common with Diana's research. So this reduction of energy consumption to uncomfortable or inconvenient levels because we were running out of money to pay our home energy bill. So this starts to take that uncomfort, that discomfort feeling, and really attach it to ability to pay, right? Which is the focus of the ACF OSC team because of their administration of LEAP, right? Here's another one. We could not use our entire home because we could not afford to heat or cool it. This is very, again, common in rural populations. I'm sure it's common in urban populations as well. A lot of my rural families just shut down whole sections of their home in the winter, and they only live in the living room and the kitchen because it's all they can afford to heat. So the whole second floor gets shut down, right? The whole back hall gets shut down, and the whole family, Rosie is nodding, right? Rosie's like, this tracks, right? So, and they literally, and again, I have to say, like growing up in rural Vermont, like, this was what I experienced myself, right? Is that we had to shut down sections of our house because we just couldn't keep it going. In the last, so this other concept is, did you ever leave this is an interesting one. Did you ever leave your home for all or part of the day because there wasn't enough money for the home energy bill? Or did you ever turn off your hot water because there wasn't enough money for the home energy bill? And again, this is kind of like drilling down into these very, these dimensions. Again, this is like pulling forward the themes that Diana had in her instrument, again, expanding from some of those very specific one-item questions into this experience of the domain. Next slide. And then again, we can start to see ourselves as we go down the scale, getting into possibly increased severity. So worrying about was up top, and we're moving down the instrument. And these questions are all numbered I couldn't pull I didn't put the numbers on different sides. So did you ever not pay your home energy supplier because there wasn't enough money for your home energy bill? Did you ever use your kitchen or stove or oven to provide heat? Again, that's a theme, right? And not paying is also a theme. Did you ever reduce your expenses for what you consider to be basic household necessities because there was not enough money to pay for these and to pay your home energy bill? This goes into the interconnectedness. And again, Diana and Stephanie are experts in this, but one of the things that we talk about and they know and speak to so well is what can be reduced and what cannot be, right? Like food costs can get reduced, utilities you can turn down, housing you have to pay, right? And so there's the negotiables and the non-negotiables, and we know this is the experience of the families that we care for, right? Is you negotiate, you reduce what you can reduce, and you focus on what you can't. We also know this in the experience of food insecurity, right? Parents reducing their own intake in order to allow children to maintain theirs, right? This is all what we know about how the things that can be modified are modified. Diana or Stephanie, anything else to say there? Stephanie,
Sorry, trying to unmute. I think this is right on. I think this is sort of the core to what we're always trying to say is like how interlinked these things are. So I think you just described it really well.
Okay, great. And one of the things too is that, and Stephanie, again, I get to work with heroes on this domain. These researchers are people I have admired for a very long time. But the idea that these things, like from an interdomain perspective, is asking about the things that can be modified is a good early question. Like food insecurity is a good canary in a coal mine for other things because it's a modifiable one. Families will can reduce it, so they do. Next slide. All right, and then here we get to the end of the scale, right? So in the last 12 months, did you ever have a supplier of your electric or home heating service threaten to disconnect? Right, so there's that theme of threaten to disconnect. Oh, so Scott, we have an answer for you. And then in the last 12 months, did you have a supplier of your electricity or home heating fuel disconnect or discontinue? So Scott, welcome, a CMS OMH friend, is asking about using the kitchen stove or oven. What about space heaters or kerosene heaters? Diana and Stephanie have lots of smart things to say about that. Stephanie, they are included in the fuel types. And Stephanie and Diana, do you want to respond to Scott's comments on space heaters and kerosene heaters? Any thoughts there as fuel sources?
Yeah, I mean, we've included a bunch of different things as fuel sources. It's a good question about yeah, sorry, Diana, I should know whether you have that specifically in your questions. I don't remember offhand. Do you?
Yeah, I believe we use stove, oven, or space heater. So basically like
Got
heating
it.
alternatives. But we don't necessarily specify whether or not that space heater is electric or kerosene.
So if that we call that a coping, like it's for you it would be in the coping strategies area, Diana?
Yeah, it's like an alternative heating method as a coping strategy. And that's either like, I think it's often connected to either trying to do like space heating, as in that question of like not being able to heat your whole home. So then you have like one heated space, or some designated heating spaces, or it's often because of inadequate heating capacity, or the primary heating source is unavailable.
Mm-hmm.
So there are different reasons for why people would use it essentially.
Yeah. And so I hear reasons because the primary heating source is outside of your control. Reasons because the primary heating source is unavailable because you couldn't pay the bill. Reasons for like the list is long. So Scott, did we answer your question?
Yes, thank you.
You're welcome. All right, so I think that's the end of the ACF OCS Home Energy and Security Scale. So we just went on a journey, right? So we had our Children's Health Watch start. We talked about all those brief screeners for a little while. And then in addition to the Children's Health Watch, again, those measurable dimensions, we expanded those dimensions with the experiences and indicators in Diana's research. And again, you can find that on the Confluence. And we're adding and reinforcing those dimensions, really kind of specifically with echoing it within the ACF OCS. So I hope that was a helpful little journey. We're going to pivot a little bit, but again, these are the themes of the dimensions. And if you go back again, I just want to go back to the first slide for ACE. Yes, so here, just to land here, not saying that this is the case, but based on precedent, when we have scales, some of these early questions can be successful early brief screening instruments. Right. And, you know, I can see Children's Health Watch doing this study in T-minus 2 weeks. Right. It's like these like that worry element is that first experience, and then having difficulty paying and having stability problems and moving into quality and experiences and coping. And then actually like that quantity, actually having it shut off being the final like reality there. And the ensuing nature of that, right? And the how it gets experienced is with that, you know, too hot, too cold, those physical elements that Diana had in her literature. And you can see that when you don't have enough, when you're like reducing, or you don't have control and you're reducing, you can see that in Diana's literature and in the some of the middle questions within this scale. Any questions there? Yes, heating pads. Yes. Again, my home I grew up in was a 1700s farmhouse, and we loved our hot water bottles. Wonderful. Any
Hot water bottle. I could picture that, but I couldn't think what it was called.
I know I still
Thank
have
you.
mine. I read
Such a long time ago.
I read jelly hot water bottle. I still have it. It's really good. You warm up the bed first, you put it in the cold bed, and then you run in and you jump in, and so it's not as freezing, and then you just curl up. Oh, yours is pink. Okay, fantastic. All right, so now we're going to pivot slightly. Again, thank you for this journey. And again, the highlighted things are these dimensions, those measurable elements of the domain, and those can become really important statements like that we want to identify in patient records as concerns, because they help us stage acuity, as Elena was talking about, right? And they also can lead to direct interventions. Warming a bit with a hot water ball, it's the best. Then your pillow's still cold though. That's the like that was the experience that I always wanted. Warm sheets, cold pillow. All right, next slide. We're going down into this other supplemental questions. Next slide. I think we're going to go to the end of the scale. I'm sorry, I took us back. Okay, so now I just wanted to land here again. I should have just landed on this slide. So this is this work in progress. This is this idea of how the dimensions common across financially driven insecurities might relate to the dimensions we're finding in these included instruments, right? Worry, difficulty paying, rationing, and shut off, and then this too hot and too cold. Again, I just threw this out there. And I just wanted to, just because we're working on this, and again, I didn't even check it with the SMEs, my apologies. But we started to think about, again, the full breadth of dimensions across the Children's Health Watch instruments and Diana's instruments and the Administration of Children and Families instruments. We start to see how we've filled out our dimensions now, right? We started with a limited set, and now we have a robust understanding of the experience of the domain. Lucy, yes?
Maybe the last on this excellent scale is nothing to be done.
Oh,
But
yeah.
we don't talk about that or acknowledge it. And I'm just wondering, really, from a social policy or population health point of view, would we like to know that nothing could be done about a problem, about the utility problem, and therefore structural or political intervention has to be thought about?
We absolutely do. And in fact, I talk long and late on Friday evenings with Elena Kalinowski, and I have had many talks about that, right? So it's important to assess when there's nothing left, right? And it has to be a policy change, right? That actually goes back to that aggregation an outcomes use case as that third use case, right? It's like, so those pings of where I've done everything, they're connected to all the things, they're still having a hard time, right? So that statement, which really is a population health, community level, like something must be done upstream ping is actually, I think, the mission. Like we don't want to just address the individuals like as they come down the stream, right? We want to like solve the problems of the person, like if we can in front of us, but then change the system so it stops coming down. Elena, anything to say? I put you on the spot there, friend. Or maybe you're not on the call anymore. She might have gotten off, but yes, but that delta between the space between patient qualifying and patient still has a problem, or patient not qualifying for LEAP and still having the experience, like all of that's really important. Oh yes, so Scott raises another question. This is actually, I wish Debbie was on the call because she cares about this so much. So their research, Scott's asking, in addition to worry over bill being overdue, worry about consequences of coping mechanisms, right? The safety factor of these supplemental heating sources is definitely of concern. Diana and Stephanie, do you want to mention on that? Anything on that? Because again, that's one of Debbie's favorite concepts. Right?
Yeah, I mean, I think that was the genesis of the cooking stove question. It came from clinical experience and hearing from patients that that's what they were doing, but then also hearing about the consequences of like people getting burned and things like that. So
yeah. Thank you so
Well,
much.
I think, I mean, as we know, as the evidence based on gas stoves, for instance, is increasing, and we know that, you know, there's carcinogens and other things that are stemming from or emitting from gas stoves, that the fact that, you know, most times people are thinking about stoves for cooking purposes and not necessarily for heating purposes, where, you know, it would be on for hours on end and that kind of thing. Like, I think the safety component of it and the exposures to toxins is also a critical piece. So yeah, I think we're very much thinking about those safety and health concerns that flow from these alternative heating methods, or the denial of comfort, like, you know, folks that are not using air conditioning or heating because of the cost. There are like those kinds of that also has like kind of down some downsides and cascading effects from a health perspective.
And Tom is echoing this. So Tom was right there with the air quality elements as well. And Scott, I hope that answered your question again. Like, because one of the settings of Children's Health Watch is in emergency rooms, and so that was one of Debbie's original comments on the intersection of alternative heating sources and safety. All right, next slide. Great. So this is what we call a critical supplemental question. So when something's too important to forget, we put it here too. The next concept would not necessarily is not a screener for utility insecurity or energy insecurity, but it's a really important thing to know. So important that Dr. Hernandez included it in her research, and the amazing Dr. Frank was passionately advocating it for it to be included. And so, Diana, can you remember? So it's the public health, it was New York Public Health, or Department of Public Health was the original source for this question. I'm trying to remember.
Yeah, the New York City Department of Health and Mental Hygiene.
Thank you so much. Welcome home. So in discussion with the SMEs, it was clear that in addition to the selected questions used to determine presence, sorry, there's a 2 missing there, to determine presence of energy insecurity, it's critical to include questions to determine health risks and the presence of energy insecurity. Specifically, questions that determine presence of medical and adaptive devices that are dependent on electric supply. So Lucy, I promised you we'd come back to this, and here we are, right? So Dr. Hernandez just gave us the source. This is the standardized question that she used in her research, and we present it here. Next slide. We also have American Disabilities, the ADA toolkit that we found for preparing for the disaster preparedness for energy, for electric outages and the presence of these devices. So we have that too, but that was just supplemental. So the question is, do you, and this is a simplified question, the question as framed in the tool had both like an interviewer administered question or a web-based self-administered question. Because most of our tools are self-administered, we're just highlighting this view here. So do you or anyone in your household regularly use any medical devices at home that are important to health and require electricity to run? And then you can see why this would be important, right? And then if yes, what type of electric medical devices do you or someone else in your household have? And you select all that apply. You know, our Debbie, our Dr. Frank is so passionate about this. She feels like it should be asked as part of medication reconciliation, which I love. This understanding of, of community dependencies on electric supply for critical machines, but and adaptive devices. But this question that was one of the variables assessed in Dr. Hernandez's research, and is very, very critically intersected with energy insecurity.
Sarah, this question needs to go into USCDI.
Yes, I know. I had this thought.
Somebody is going to recommend this for the next cycle, right? Or the cycle after. It's so basic for health.
It is very basic. Yeah.
Thank you.
And I hope so you can see why our SMEs were so passionate about, so Diana including this in her research and our SMEs including this in our work here. Again, not a primary screener, but like a must know, right? Because it's really critical for taking care and establishing risk. And then Lucy, thanks for that. So I think one of the things we're thinking about is, again, this is again part of our outcomes and aggregation discovery, is how to measure that like structural intervention required statement. Right, policy apply. And this all goes back to our one of our foundational models, right, is the World Health Organization's conceptual framework for action on the social determinants of health, which states very clearly that as clinical entities and social entities, we have a responsibility for advocating for policies that address the upstream causes, like it's part of our charter and our mission. And certainly Gravity has referenced that model from our inception. Yes, and so yeah, so hopefully we'll touch upon that in the outcomes discovery. Okay, whew, I told you it was going to be a long one today. Next slide. I think we're good. We're at 5:20. Working definitions are still in progress. We did have a couple things we wanted to highlight as we explore how to apply energy and security measurement in rural populations. We want to note that a while ago, I found this lovely video on using LEAP and wood heat at the intersections of how to use LEAP energy assistance if you are a wood heat user and your primary source. And the Administration of Children and Families, Office of Community Services had a lovely webinar on this. And so that's on the Confluence now. And then we just want to note that because of the all national application of the instrument, the ACF OCS does have some pretty good robust fuel types. And then Stephanie was talking about that as well in the primary question in the Children's Health Watch instrument. Again, always trying to make sure we address the rurality question. Lucy?
This conversation has been so wonderful. I'm looking at this first excellent definition: inability to adequately meet basic household energy needs. After this conversation, could we imagine adding inability to adequately meet basic household and personal care needs?
Oh, okay. That's a good idea. I'll take that.
It's so basic that utility insecurity may have nothing to do with hot or cold in your house or whether you can cook. It has to do with whether you can keep breathing.
Given that that's Diana's definition and that Diana's the one who did that variable in her research, I'm sure Diana will love to help us consider this when we meet again tomorrow. Thank you, Lucy. I'm so glad that you found this conversation valuable. And again, I always am grateful for
I certainly have. I'm sure I'm not alone in that. Thank you.
Yes. Any other thoughts here before we move on? Again, we've had a really lovely conversation, and I hope you feel like how honored. I mean, our subject matter experts are just so helpful and are guiding us so expertly in all these concepts. So thank you so much, Smeeze. Janice?
I just wanted to add that in addition to Leahy, like in Seattle, like King County, and I
Mhm.
expect the Pacific Northwest, Oregon too, where we have quite a bit of water and we generate electricity, right? We
Mhm.
might have more robust local
Yes,
offerings.
yes.
And so like I actually qualify for one. I looked at it recently and I didn't realize that I would qualify, but I think you make under it's under maybe $48,000. It
Mhm.
might even be more. I mean, our mean here in our county is 60,000, or that's low income. When you're below 60,000 is like, you know, you're going to have a tough time renting and living in greater Seattle area. So anyway, it's just different everywhere you are. But and so I think some people actually can qualify for more than one. And
Yeah.
our all of our housing authorities here just added in, individuals used to have to register separately and they just gave it to like everybody that's in affordable housing. So
Great.
yeah, and which is an excellent policy. So anyway, yeah.
We have it. So when we're going to try, so now that we've expanded our dimensions, it's operation programs and interventions next. And again, this is an area of expertise of our subject matter experts. Diana has a paper on this, which I think is also available on the Confluence. And then if you look in the Administration of Children and Families, Office of Community Services, LEAP webpage navigation, they do a really good job of state by state showing you all of the different layers of programs. There's the LEAP funded programs, there's the state funded programs, there's the local programs, there's the charitable programs. And so definitely from the lens of ACF and OCS and our SMEs, that like blending and braiding is part of our of the federal approach, of our subject matter experts approach, and will be part of our approach as we start to develop our program terms.
Yeah, also, like when somebody registers for, I think, I'm not sure about utilities, but definitely food, food stamps, EBT,
Yeah.
and I think utilities too. You can automatically,
Yeah.
or Medicaid, you can get automatically like added on to the other ones. It's taken years and years and years to break that, but it happened during COVID out of necessity, right? And so seeing that the need, and so you can not used to only be, do you want to vote, which in all the programs, but now they add in, you can apply for this, you can apply for a phone, you can apply for discounted broadband, so it's some of the organizations have connected it. Our state's done a pretty good job of that.
Yeah, you are. I think Stephanie is a policy wonk, so I think some of that is state to state and state dependent. But certainly some states have that kind of, like New York has an automatic, if you qualify for Medicaid, you get a reduction. Again, Diana, I think it's right. Yet there are states that take that approach, right? So again, we have these federal approaches through LEAP. And then we have state-based approaches, and then we'll start diving into that when we get into our next meetings.
Thank you.
Sorry. Okay, and then a couple more slides. We don't have any additions to programs, so I think we can roll through because we're really focused on dimensions. I just want to land on the homework before we go. I don't think we have any additions to programs, right? It's next slide. Yeah, next slide. Again, Program Central next time. Next slide. Next slide. So if you have ideas like Janice just did about critical programs that you feel like you want us to include, or any instruments that you feel like you've missed, please submit them. And again, any roles that are really critical that you don't see, we want to make sure that we identify the people that are helpers in this space as well. And you can always review the materials on the Confluence. Again, the master will get posted tomorrow afternoon at 5 o'clock EST. Thank you. Any other comments, friends, or Gravity team, or anybody else? Thanks for being on this journey with us. We'll see you in 2 weeks. You can please attend the terminology, the technical call on Wednesdays. And if any of you are going to HIMSS, I'll see you in Orlando next week. Looking forward to that, and we'll see you in 2 weeks back here. Thanks so much.
Thank you.
Thank you.